There have been a lot of articles circulating over the last few days saying that probiotics are useless and can actually hurt you. Now, if you are one of the millions of people across the world currently taking probiotics, you might be a little confused. I'm Molly, I'm the nutritional therapy practitioner at parsleyandpumpkins.com, and we are going to take a look at these studies to see what they actually have to say about probiotic use. So before we do a deep dive on these studies, I'm actually going to give you the cliff notes. Number 1, your microbiome is very important to your overall health. Number 2, a stool sample is not an accurate representation of what's happening farther up in your gut. Number 3, people have unique responses to probiotics. Everyone's microbiome is a little bit different, and a one-size-fits-all approach is not appropriate. Now, these studies were done on already healthy individuals. So if you are taking probiotics for a specific reason, something that was recommended to you by your doctor or a holistic practitioner, you do not need to worry about these studies. They are not relevant for you. Number 4, we learned that antibiotics definitely do wipe out your microbiome. And number 5, we learned that taking a probiotic after a round of antibiotics might actually make it harder for your original species to repopulate afterwards. And that is a really interesting finding. Okay, so let's do a deep dive. Now, the first study asked the question, is a stool sample an accurate picture of the gut microbiome? So essentially, they took 25 people, took a stool sample from each of them, and then they did an invasive procedure to get samples from 11 different places all along their gut. They looked at the species found in each part, and this image shows the most common species. Definitely does not show all of the species. There are hundreds of different species in the human gut. This shows about the 20 most common ones. And they took 2 samples. So we have the mucosa sample, which is like they scraped a sample off the wall. It's a little bit of a deeper grab. And the lumen sample. So this is basically they vacuumed around the area, and that's what's in the lumen. So we can see the stool sample and compare it with the mucosa samples to get a really good comparison. So obviously a stool sample would not be a good indicator of what's happening in your stomach or higher up in your small intestine. That's of no surprise. And when we look at the lower intestine, the stool sample is much more similar, but it's not a mirror image. For example, we see Flexospira, Streptococcus, and Bifidobacterium in the stool, but very little actually colonized in the gut. Similarly, from the stool, it might look like Lactospiraceae and Bacteroides are approximately equal amounts, which is not at all the case in the gut samples. Now, this is important because stool sampling is the most popular method for analyzing the gut, and it does still have clinical use, but we need to be aware that it is not a mirror image of what's happening farther up. So next up, the researchers wanted to see if probiotics actually colonize in the gut. So they took 15 people, 5 of which received a placebo and 10 received probiotics for about a month. And again, they used an 11-strain probiotic with about 25 billion active bacteria and administered it twice daily. So what they found is that some people's guts were colonized and others weren't. Of the 10 people who took the probiotic, 6 of them saw an increase in colonization and 4 of them did not. So essentially, they labeled these 2 different groups as permissive. They were the ones that did see a colonization. Their bodies permitted the probiotic to colonize. And then a resistant group. So their bodies were resistant to colonization by the probiotic. And we can see on this image how much of a difference there is between the permissive group and the resistant group. Okay, so what this shows us is that not everyone reacts to probiotics in the same way. The lesson is that probiotics are not a one-size-fits-all solution. So of the 10 people who took the probiotics, 6 saw an increase in colonization and 4 didn't. And it's very important to remember here that these are 10 already healthy individuals. So at the very most, we can extrapolate that if you are already healthy and you decide to just take a probiotic, you have about a 60% chance of it actually colonizing in your gut. Now, the researchers did actually find certain immune characteristics that were distinct in each of these groups. So they suggested that somewhere down the line, we might actually be able to develop something like a blood test to see whether or not you need probiotics, what strains, and if your body is going to respond well to them. But that's quite a long way off. So for now, we will continue doing what we are already doing, which is to look at the individual person. Take into consideration any conditions, persistent symptoms, look at the person's history, and make the most informed recommendation that we can. So if you do have a health concern and your doctor or a holistic practitioner has recommended probiotics for you, you do not need to be worried about the results of this study. It is not relevant for you. We cannot use this information to extrapolate what would happen if the group tested had some kind of chronic constipation or recurrent UTIs or some kind of disease like celiac. So please don't let these studies freak you out if you're on probiotics for a specific reason. Okay, so the second study asked, does taking probiotics after an antibiotic help repopulate the gut? Now you might be wondering, hasn't someone already researched this? Yes, they have, but they've been looking at stool samples. And as we just saw from the previous study, stool samples are not a perfect picture of what's happening in your gut. So essentially, they wanted to retest this hypothesis with these more invasive methods that allow us to really see what's going on throughout the entire GI tract. Now, what previous studies found is that it can take a few months after antibiotics for the microbiome to stabilize. And unfortunately, the diversity might not be exactly what it was before the antibiotics came on the scene. And this has been a big concern for professionals because there are many unfriendly bacteria that would like to take advantage of the situation by colonizing with pathogenic bacteria. So the idea has always been, if you have to take antibiotics, take a probiotic afterwards to protect you from these pathogenic bacteria setting up shop. So this graph is a really good visual of what they found. So we're looking at a time period and we're looking at the species diversity. So how many different types of bacteria were found. Now, species diversity is one of the characteristics of a healthy microbiome. Different species do different jobs and act differently, so you want as much diversity as possible. So we're looking at 3 different groups here. So the red is the spontaneous group. So they were given antibiotics and then their guts were allowed to just spontaneously repopulate. The brown group is the fecal microbiota transplant group. So essentially they took a little bit of a stool sample, saved it for later, and then used that to repopulate their gut after the round of antibiotics. And then the green group is the probiotic. So they received the 11-strain probiotic. So what we see here is that the FMT group recovered fastest, followed by the spontaneous group, and then the probiotic group was last. And it actually took as much as 5 months or longer for the probiotic group to fully recover their full biodiversity. This is really interesting data, but it is unclear how this will be clinically relevant. Now, the researchers actually suggest looking further into some kind of personalized probiotic system, where basically instead of relying on just a generic probiotic after you have had your gut wiped out by antibiotics, we come up with some kind of system to analyze what your microbiome already looks like and then use that to repopulate accordingly. Now, this is pretty far off into the distance of what is possible for us, but that's absolutely where we are headed. So the researchers do note that the FMT group had the best recovery times, but it's not an easy solution to implement. Oftentimes you don't know when you're going to need antibiotics, and so having a fecal microbiota transplant ready to go is not really within anyone's means. On the other hand, if you do know you're going to be exposed to antibiotics, say you have a surgery scheduled, maybe you're pregnant and at risk for a C-section, this is something that you can talk to your doctor about as a possibility to have a fecal microbiota transplant ready to go so that afterwards you can repopulate much more quickly with your own biodiversity. Now, this study will likely cause some medical professionals to reconsider their blanket recommendation of probiotics after a course of antibiotics. And certainly the person's unique presentation needs to be taken into account. Their symptoms, their history, how many rounds of antibiotics they've had. Studies definitely have shown that the more rounds of antibiotics you have, the harder it is for you to regain full biodiversity afterwards. And the most obvious lesson here is that antibiotics should be a last resort for a very specific reason. There are absolutely instances where antibiotics are needed and can save your life. But there's also a concern about the overuse of antibiotics, handing it out like candy for every cold and flu, and the potential for antibiotic-resistant bacteria to continue developing. So a big takeaway from this study is making sure that we are supporting the body with healthy food, addressing any nutrient deficiencies, really supporting healthy digestion so that antibiotics are not needed in the first place.